Back now to our top story, the veterans scandal. Senior political analyst Bret Hume is here tonight with what it tells us potentially about government-run health care. Good evening, Bret.
Hello, Bret. The spreading scandal of delayed care at Veterans Administration hospitals and the unraveling efforts to cover up the problem have resulted in predictable calls for the resignation of VA Secretary Eric Shinseki. But the VA has been plagued with patient backlogs for as long as I can remember, and the problem has defied all efforts to solve it. The fact is that long waits for care are common to government-run, taxpayer-funded health systems. Think of all the complaints you've read about long waits for care in the socialized medical systems in Britain and Canada. They are what happens when the government owns and operates the hospitals, pays the doctors and nurses, and finances it all out of a central budget. As Michael Tanner of the Cato Institute points out, the delays are simply a form of rationing. This is an inconvenient truth to those who believe in full-blown socialized medicine. But it is also inconvenient to those who merely prefer a single-payer system where the government does not provide the care, but does pay the bills. That's how Medicare works. It may be popular because it's supposedly free, but people who can afford it buy extra private insurance to cover its gaps. That's also how Medicaid works. It's free too, but good luck finding a doctor who will treat you. The number of physicians who take Medicaid has been declining for years, and a recent study of 15 major cities found fewer than half their doctors now treat Medicaid patients. Bret?
Bret, the most important part of the story obviously is treating veterans, making sure they get the care. Both sides of the aisle are outraged by it, and it does go back many, many years. But as in this town, we often look at the political implications. What do you think they are as this thing unrolls?
Well, it feeds into the question that's been raised about the president before, and that is whether he and his team can manage anything. We had that after the fiasco of the rollout of Obamacare, and of course Obamacare, feeds into this whole Medicaid problem, which is out there as well. The best defense for the administration would be, look, this kind of system doesn't work at socialized medicine. It doesn't work anywhere, so it's not Eric Shinseki's fault and it's not my fault. Somehow, however, Bret, I don't think the president will say that.
Doubt it. Bret, thank you.